Hello, good day to everyone. We hope that you're having a wonderful day. Dr. Stillman will be joining me shortly. He is just finishing up. Yes, Levi, it's today. So give me a one in the chat if you can hear me. You mute my live feed from YouTube because I'm checking on that as well. So go ahead and give me a one in the chat if you can hear me. There's no point in me getting started unless you can actually hear me. Thank you, Levi. I appreciate that. Yes, this is today. We're excited to give you guys a whole bunch of value. Thank you so much. We got Michael. I'm not even going to try and pronounce your name. Lots of people in the chat. Great. Where are you guys from? Give me some where you're from. It's always interesting to see where you're from on this kind of stuff. Thank you, Moss. Thank you, Robert, England. 10 below 99. Thank you. Michael, good to see you, my friend. Matthew Pittman, good to see you. Lots of people in here. This is great. As you know, yes, Cincinnati. I used to live in Lexington, Michael, as you know. As you know, men have kind of been under attack from all angles, emotionally, physically, spiritually. And Dr. Stillman and I really want to share with you a lot of great information today to help empower you guys. And we're going to provide you with the information to get yourself going in the right direction, and also provide you with the opportunity to work with both of us to help keep you accountable. So did anybody have any questions before we get started today that we want to address specifically today? Because we want to provide you guys with as much value as possible. Yes, Michael, you could have worked out in my gym for sure, 100%. My gym was a really cool place. I had it for quite a long time. I think, one of the biggest things I see in the people that we work with is really people get paralysis by analysis, and they have so many things that they're looking at and so many shiny objects that they really don't ever take true action on one or two few things that actually will get them results in the long run. Here is Dr. Stillman. Dr. Stillman, we have people from all over the place, from Virginia Beach to Cincinnati to Tennessee to Ireland to Birmingham, Alabama.
It's great. Hello, everyone.
Got a lot of people in the chat on YouTube and on StreamYard. So
it's great.
I was just keeping them entertained while you got yourself pretty.
That's right. Should we dive in?
Dive in.
Awesome. All right. Drop a 1 in the comments if you see the presentation. Excellent. Okay. Secrets of testosterone optimization. Jim and I have been looking forward to doing this for a long time. I should have added his name to this. Oops. Not perfect. Imagine that. So today, what we're going to talk about, why men today have lower and lower levels of testosterone than they have historically, how this is affecting them mentally and physically, and what to do about it. Who am I? I'm a general practitioner, medical doctor. I specialize in functional and integrative medicine. I've been featured by Ben Greenfield, Mind Body Green, Joe Mercola, and many more. If you want my podcasts, just Google them. You'll get a lot. And now I run a 99% virtual practice from the great state of Florida. Jim and I have been working together for about a year. Jim's a strength and conditioning coach, 25 years of experience, former power lifter. He has got a great reputation for getting people results quickly and efficiently and looking far beyond exercise, unlike most, I would say, fitness professionals. And he's worked with just about everyone you can imagine, but he's certainly worked with a lot of men who were concerned with and had issues with their testosterone. Jim, you want to add anything to that?
That about sums it up.
All right, great. Okay, so in this webinar, we are going to talk about what really matters when it comes to testosterone. We're going to talk about the top reasons that we see men failing in their health journey as relates to testosterone. And we're going to talk about how to navigate the current trends and fads to get great results at a price you can afford, and how our team can help you and serve you to achieve the good health in the body that you desire and deserve. You can follow me at Substack, Instagram, Facebook, Twitter. It's pretty much Stillman MD everywhere. I'm also on YouTube. If you just put my name into YouTube, I'll come up. Jim's handles are Jim Laird, Gym Laird, and then you can look him up on Facebook, and his Twitter is actually his name, 44. All right. So low testosterone, if you're watching this, testosterone when I was training years ago was not that much talked about in the public square, but it started to gain more and more traction as I went through training and then came out of training. And now I hope it's common knowledge. And if it isn't, then this is important news for you to know. Low testosterone is associated with heart disease, dementia, stroke, diabetes, depression, cancer. All the top killers of men and women, frankly, are associated with low testosterone levels, which makes optimizing testosterone levels for men a really vital part of remaining healthy and well. The top symptoms of low testosterone are decreased libido, decreased energy, decreased strength and endurance, which just means athletic ability in general, loss of height, less enjoyment of life, sadness and grumpiness, fatigue, particularly in the afternoon or evening, and poor work performance. And one of the most important misconceptions that we have to address is the idea that normal testosterone labs mean healthy testosterone levels. So we've talked about this, I think, a fair bit on, podcasts and different recordings that we've done on social media. But it's really important for people to understand that normal testosterone labs are not healthy testosterone levels. 100 years ago, the normal testosterone level was somewhere around 1,000. And people will debate back and forth what it should be or was. But the bottom line is that's around where it was. If you look at the levels today, the normal defined by LabCorp has just been revised down yet again. So normal is now something between 200 and 900. So they're virtually speaking, they're defining the current populace as healthy when in fact they're 2/3 or even 1/10 arguably the men that their fathers and ancestors were. We think that's very crazy. Jim, you want to add anything to that?
Yeah, it's a combination of modern life, doing less activity combined with nutrition. We're going to get into all that stuff, but literally everything in our modern world is just destroying men's testosterone.
So that being said, it's really important for you to also understand that low testosterone doesn't mean you should just replace testosterone. I will sometimes say, to be provocative, the last thing with men with low T need is testosterone. And I don't mean that they don't need testosterone replacement. Personally and professionally, I think testosterone is what makes being a man fun. So if you have low T, I really think doing something in the, having a plan to normalize it, whether you're going to try and do it without replacement or exogenous testosterone or Clomid or anything else, or you're going to go a pharmaceutical or bioidentical hormone route to replace it, is really important. But you've got to get all the things that create a normal, healthy testosterone level in the mix and properly addressed, so that you need as little replacement as possible. We see a lot of men looking for the quick solution of the testosterone injection or the testosterone cream or oil. And this isn't the best long-term strategy if you're not addressing the underlying causes of the low testosterone levels. We're going to talk a lot more about that. This comes back to really my philosophy of medicine, which is the greatest medicine of all is teaching people how not to need it. Hippocrates said that, and I think he was very right in saying this. It's very important to understand that the goal in what I do is not to put you on a prescription that you have to come back for refills of for the rest of your life. That I sometimes say that that's a great business model, but it's not the best thing for the patient. The best thing for me to do for you, if you're listening to this and struggling with your health, or even if you have good health and you really want to maintain it, my responsibility to you is to help you understand how to need as little medicine as possible for your whole life. Because ultimately, testosterone optimization comes back to being in nature the way that we're meant to be. So if you're struggling with low T or think you may be struggling with low T, you may be wondering, is there something wrong with you? Will you have low testosterone levels for the rest of your life? Why is it so hard to have a healthy level? Why is this happening to you? And what's it going to take to look and feel the way that you want to? We're going to talk more about that. Low testosterone levels overall leave men feeling confused, shamed, broken, disempowered, hopeless, despondent, useless, and fearful. And we're here to help you understand the way out of these emotions, whether or not you wind up on testosterone replacement therapy. And this gets back to what I've been talking about, the whole time, which is really the key to optimizing testosterone is getting to the root cause of why your testosterone levels are low. And this brings me back to another quote from Hippocrates, the father of medicine in the West. He said, "Illnesses do not come upon us out of the blue. They are developed from small daily sins against nature. When enough sins have accumulated, illnesses will suddenly appear." So what this means, it's essentially is that there's small things that we do on a daily basis, our habits, our choices, that can torpedo our wellness and particularly our testosterone levels. And so if we're going to normalize these levels and protect these levels, the key is to improve our health and correct these mistakes so that our bodies can operate the way they're supposed to and have the healthy, high testosterone level that we're meant to have. So I decided for this webinar to break down the top causes of why I see men struggling with low testosterone from my perspective as someone who's treating them and somebody who's really studying the literature and paying attention to all these different trends and areas in integrative and functional medicine. So these are the top 8 causes, and these are not in any particular order. It's really, these all play a role to one degree or another in different cases. And some men, it's like 80% is their toxic burden, and some, 80% is their artificial light exposure, and some of them 80% is their stress. And frankly, it's really relatively academic which one is your major stressor or what combination is really getting you down. The key is to understand all of them, because you're going to face different problems at different stages of your life. And that means that the causes or contributors to a low testosterone level are going to be dynamic, and you need to be ahead of that if you're going to maintain your levels. So these 8 causes are stress and poor sleep, artificial light, lack of sunlight, head trauma, EMF, that's electromagnetic radiations, nutritional deficiencies, toxic burden, and a lack of weight training and exercise. So let's start with stress and poor sleep. So for starters, what is stress? Stress gets a really bad rap in the natural and anti-aging world, right? People just say, oh, stress is bad, we need to avoid stress. I don't think that's fair. I talk about this more in my book, Dying to Be Free, which if you haven't bought a copy and read, you should. It's a really good book. And explains a lot of this in more detail than I can get into in a webinar. But stress is what keeps us strong. Really, it's the stress on your body, for example, with weightlifting, that causes your muscles to get bigger and, for you to get stronger. So the idea that stress is bad is very much a reductionistic way of thinking that doesn't really reflect reality. But modern stress, we have a lot of artificial stresses that we're going to talk about more later that can ruin or affect testosterone levels. So things like EMF can affect sleep. Things like artificial light can affect sleep. Psychological stress can affect sleep. All these things are stresses that can affect not only daily performance and function through affecting your steroid hormone levels, which we'll get into in a minute on the next slide, but they're also impairing sleep, which is where we recover from stress and we're able to bounce back from stress and respond to stress. So stress is a really important factor in the epidemic of low testosterone levels today. It's also arguably the thing that we can control the best or the most in our lives. So let's talk about some really important associations here. So stress, insulin, cortisol, and testosterone. So the more stressed you are, the higher your cortisol levels are going to be. When you go through a stressful event or situation, cortisol gets released from your adrenal glands along with stress neurotransmitters, dopamine, norepinephrine, epinephrine. This A, suppresses your appetite in many cases. B, it will trigger your body to tear down muscle and bone. And the reason it's doing this is really that your stress response is trying to focus you on the problem to either run away from the problem or eliminate the problem, the fight or flight response, okay? So this is a really important part of our normal natural physiology. We don't want to avoid it, right? You want to have these hormones and neurotransmitters available to you, and you want to have them on board when you're, say, in the gym, because if you don't have any of these running around in the gym, you're not going to be able to do anything. You will literally collapse in adrenal exhaustion or Addisonian crisis, and you'll be taken to the ER, and that's a real actual medical problem some people develop, okay? The more you trigger cortisol production, the more it's going to steal pregnenolone from other sex steroid hormone pathways. Estrogen, progesterone, testosterone, all these hormones, DHEA, etc., they're all produced from the same parent compound, which is ultimately derived from cholesterol. So the more you're under stress and the more you're ramping up those stress steroid hormones, the less pregnenolone is going to be available for testosterone production. Okay. This is why we see routinely low testosterone levels in people who endorse being under more stress chronically and acutely. Okay. What's the connection with insulin? So insulin, and this is the interesting thing about cortisol, right? Many of you have had the experience of being under an acute stress or a chronic stress and you eat less. But then when you do eat, what do you reach for? You tend to reach for foods that are convenient, that do not require you to think in order to cook and prepare them, that are readily consumed. These are often high sugar, high carbohydrate foods. And that's honestly, in nature, that's a normal thing. You're looking for the carbohydrates because when you're under a lot of stress or an acute stress, your body is saying, okay, we need to have some carbohydrates and some calories around because we're about to go through we may have to fight something or run away from something, right? But in our modern world, our stress is usually coming from a screen or from somebody who's, in proximity to us, and we're not about to fight or, run away. We're having to deal with the stress, basically psychologically. And so that, caloric expenditure that normally would happen in nature is not actually happening. What happens when we add more and more carbohydrates to the mix, particularly in the absence of adequate protein, is that you're going to trigger insulin release. And insulin triggers your body to create fat. It also triggers your body to create muscle. So I don't want to vilify insulin. Those of you who understand it understand that it's an important part of muscle gain and muscle maintenance, which is really critical for men who want to optimize testosterone. But if you're getting a lot of insulin release, it can create a lot of adipose tissue, and that fat can then convert testosterone downstream into estrogen. And if you wind up with too high of an estrogen level, it can create some issues. I don't want to vilify estrogen because people will go the wrong direction and think, okay, I need to maximize my T levels and lower my estrogen levels with something like DIM or Nastrozole. This is actually a big mistake, which we can talk about more if people are interested in the Q&A at the end. But I don't want anyone thinking that estrogen is bad or testosterone is just good. You need these things to be in balance. And what you'll see in people who've got, severe metabolic syndrome from excess stress and excess insulin, which are they keep such close company, it's hard to know the difference. You'll see high estrogen levels and low testosterone levels, and we believe this is why. Okay. So stress is definitely destroying modern men. Too much sugar equals too much insulin. Stress and poor sleep equals depleted sex hormones. Too much insulin and depleted sex hormones equals weight gain, fatigue, loss of libido, stamina, and strength. So men really have to learn how to relax in our modern world because more stress is not the answer to low T. A lot of men are hearing the message from influencers and, even doctors and healthcare professionals that, they need to hit the gym, they need to exercise more, they need to run, they need to do this, they need to do that. They basically need to take more onto their plate than they already have. And I think that's a very flawed model. I think many men have low testosterone levels more so because they are under too much stress and have too much on their plate. And what they really need to do is, find a better way to manage their time so that they're not under so much stress. Jim, you want to add anything to all this?
Yeah, sure. It all comes down to balance, right? There's going to be times in your life where you have to push really, really, really hard. There's going to be times in your life where you have pushed really hard and gotten yourself in trouble. That's one of the reasons why, working specifically with us and getting coaching from us is so important. We can customize. Some people we're going to need to say, hey, you need to get off the couch and start doing some stuff. And other people we might need to say, hey, you need to hire an executive assistant and get some help in your work. Right. So there's a lot of context. And, I think a big part of it is we just live indoor lives. We become human zoo animals. And I think we're going to get into that further on in the presentation, but that's a big part of it as well.
We will, certainly. Okay. So the antidote to stress is rest. How do we relax in our modern world? Jim has a lot, and we have put together a lot of different things for you to use. Relaxation exercises, breathing drills, sauna, light therapy, and more. We really want to help men understand what they need to do to relax and get the most out of that time, because we know that your time is limited, so that you can get the optimal hormone profile, which you need in order to be well. Okay. Artificial light. I talk a lot about artificial light, and I think sometimes I feel like a broken record. But for the record, artificial light at night ruins circadian rhythms. Circadian rhythms control hormone production, and the number one cause of low T, and this is anecdotally, but I think I think it's safe to say that the number one cause of low T in general is poor sleep quality. If I see a low testosterone level in a man, the first thing I ask them about is how was your sleep in the week prior to this test? And very consistently, men who are young and shouldn't have low T will confess to me that they were staying up late, they were working too hard, they were overexerting themselves, they were using their phone or television or computer late at night, and this all tanks sleep quality through artificial light's effects on melatonin. So we have to understand that sleep quality is a combination of both duration and depth. And that's an oversimplification. And there's lots of different stages of sleep, but very simply, that's what you need. And you really need both. So you'll have people who get 8 hours of sleep a night, but they're not sleeping deeply, or they don't have quality sleep due to something like sleep apnea or low growth hormone levels or excessive stress during the day. And so even though the duration is normal, the depth is not appropriate. And so they're not actually getting really healthy restorative sleep. The same thing can be true with the duration or with the depth, conversely. So you'll have a short duration. And if you get to the right depth, even then you're not getting the same healthy restorative sleep that you need. So poor quality or duration can really tank your hormone levels. And these can be driven by many different factors, but the number one is too much artificial light at night. And number two, we're going to talk about next, which is lack of sunlight. So I feel like a broken record about this topic as well. I absolutely love talking about the sun. So sunlight and its effects on your circadian rhythms is frankly very simple, but it's often overlooked by physicians. So we need bright light for proper circadian signaling. Most people don't realize this, but their indoor light environment is very dim. So you might be working day in and day out in an office where there's only 20 lux of light. That's a measurement of visible light. When outside on a sunny summer's day, it might be 100,000 lux of light, right? So think about it. Your eye, pupil dilates and constricts in order to make you see the world around you the same as if you're in 100,000 lux or 10 or 20 lux. But you're getting tens of thousands or even hundreds of thousands of fold difference in the light that's hitting your eye. And that over time can compound to create problems with sleep. This has been really underappreciated in the conventional medical community, who will look for things like seasonal affective disorder, but seem to be totally out to lunch in terms of how to actually think about these problems and how to actually get people into brighter light in order to get better circadian rhythms. Universally, people who we coach and counsel see better sleep, deeper sleep, more restful sleep, and more energy during the day when they get more bright light during the day. As we've moved indoors, we've seen a terrible drop in testosterone levels, and this is certainly no coincidence. So remember, bright light during the day equals better sleep at night. We also have exciting new research coming out that red and infrared light may increase testosterone production in our testicles. And so I this is very new and emerging. So I don't want to overpromise and then underdeliver, but there's a lot of mechanistic data coming out showing that the light we illuminate ourselves with, including our, the actual organ that makes testosterone, is going to have an effect on testosterone levels. Okay, head trauma and abuse. So this is a very interesting area of the literature. It's very well known that we see a lot of low testosterone in particularly men who are veterans, who've undergone a lot of physical violence, and particularly head trauma, concussions, microconcussions, obviously from explosions, gunshots, etc. Right? So the mechanism here is basically repeated trauma to the brain really degrades the brain's ability to make hormones. We see this also in football players, people who play contact sports heavily. And so we see this association over time. The brain basically loses its ability to produce normal levels of testosterone because of these traumas, right? There's sort of a chicken or the egg question here, in all honesty, with regard to these phenomenon, right? Because there's a psychological aspect to head trauma. There's a lot of stress that goes along with seeing difficult things to see, seeing violence, observing violence, let alone committing violence. And there's also a really strong association between head trauma and violent experiences in adult life and childhood abuse and physical abuse. And so, one of the questions in my mind that I haven't seen appropriately addressed in the literature is, are men who are in emotionally abusive relationships, which we see a lot in our society. If you're a man today, I think you probably realize that society is not treating men well. They're in a lot of abusive relationships, whether that's relationships with the state or relationships with romantic partners or relationships with family. And a lot of men feel terrible psychologically about this. And I believe personally that this is leading them to have altered hormone profiles through some combination of factors, whether it's increased cortisol levels or changes in what they eat and how they exercise and how they sleep. Jim, do you want to add anything to this? You've had a lot of experience working with football players, people who are former military. You're muted. You're muted, Jim.
It's really, really, really overlooked. Especially with boxers, with football players. You look at a guy like Junior Seau, who killed himself. Some of the other pro wrestlers and things that fell into drug abuse. A lot of that has to do with having chronically low testosterone, and leaving it untreated is just an absolute disaster. And a lot of these athletes, they get to the point where they've been hit in the head so many times that they just can't produce these hormones. And of course, they ban these things in competition. Where the sport itself is causing their low testosterone, and then they tell people that they can't take, replacement or anything like that. So the things that would actually help them be healthy, and that's a whole discussion for another time. But
sure,
it's something that's really, really overlooked by a lot of people, and there's an absolute epidemic of people walking around with their testosterone is just tanked, and that's just not a great way to live your life.
Amen. EMF. So EMF is something that Jim and I talk about more than most of our colleagues, call them influencers. This means electromagnetic radiation. So wireless radiation from cell phones, from wireless routers, from cell phone towers, all these different things. And Jim and I catch some heat and have seen some censorship happen because we talk about these things, but we do think that it's an important contributing factor that you should be aware of. Now, I actually decided to go ahead and bring some of the literature out here. This is just one paper, and I limited myself to one paper because we have a lot to cover, and I don't want to take too much of your time, which we value. But there's dozens of articles like this. Some of them, they have various findings, right? Some of them find, associations in one parameter or another, but there's no question from my reading of the literature that these wireless radiations from cell phones and things like that, which of course for most men are right in their pocket, right next to their testicles, are having a negative effect on men's reproductive health. The only question is, what is the ultimate effect of that? So in this study, what you'll see is that they looked at the effect of low frequency EMF on testicular function and structure, which I think is a great study design. Because a lot of these studies, when you look at them, they'll look at things like sperm motility, sperm quality, things like that, but they won't actually look at total testosterone levels. And what they found in this particular study is that the EMF was significantly associated with reduced sperm motility and testosterone levels. This is very important. They didn't find an effect on the weight and the size of the testes, sperm concentration, and viability, but you'll also notice that they only did this study for 85 days in rats. If you should ask the question, right? When did I get my first cell phone? It was about 14 years ago. And that was my first, data 3G Android phone, right? So 14 years times 365 days. That's a much longer exposure time than is being studied in these poor little rats. And I really think that we've seen and this is something that we've been watching very closely. Jim just showed me an interview from Jay Campbell, who's somebody who we think is very innovative and smart in this space. And he and multiple doctors with how many decades of experience between them in testosterone replacement were saying
it was like 20 years apiece.
And there was
three doctors on there. Yeah, there's 3 doctors plus Jay.
Right. And they were saying that they're seeing the levels really precipitously decline. And in very young men who would never have been at risk for low T before.
Like men under the age of 30, under 200.
And I would say, Jim, that, many people today, like Huberman is talking about sunlight. So many people are talking about sunlight. They're talking about artificial light at night. Blue blockers used to be only for the very niched out out there biohackers. Now they're much more mainstream, and it feels like everyone's heard of them. But this, I think, especially when you look at the levels of EMF coming out of these phones, I think this is one of the big ones that people are missing. That's actually the easiest to fix, because if you just put your phone on airplane mode when it's in your pocket and you don't, leave it on your body when it's in transmit mode, mine's over here on my desk, and this is in airplane mode right now because I don't want to be distracted on our webinar. But you get the idea. This is a very modifiable risk factor. Okay, toxic exposures. This is a really fascinating area because toxins are very difficult to quantify in the human body, right? If I really wanted to tell you exactly what your toxic burden was, I would have to take biopsies of things that you can't afford to have biopsied, like your brain. So people don't do a lot of really definitive studies on toxins in low T. And, for whatever reason, the pathologists who could be doing this with cadavers, I don't seem to be very interested. And so we don't see a lot of postmortem data coming out on the role of toxins in low testosterone. To be perfectly honest with you guys, I really wonder about the agenda to not pay attention to low testosterone levels in the scientific community. I mean, it's uncanny how physicians just think about testosterone as something that should only be replaced when it's really, really super low. And they look at all these illnesses that we see in men with low T, and they just say, okay, well, you need an antidepressant for your depression, and you need, methylphenidate or Ritalin for your ADHD and lack of attention and lack of focus and poor work performance. And you need Cialis for your erectile dysfunction. And sure, you can take some creatine and protein powder because you're not performing well in the gym. And, men wind up, fat and depressed and miserable and on higher and higher doses of these drugs that then come along with all kinds of other side effects. And the next thing they know, our suicide rates. I mean, I remember when suicide wasn't in the top 10 causes of death. Now it's in the top 10 causes of death. And the number one demographic for committing and actually completing suicide is white men. So, I mean, we could talk about the agenda behind ignoring low testosterone levels, but a lot of it comes down to these toxins. And I want to talk about why. So my top toxins for low testosterone levels are heavy metals, petroleum toxins, plasticizers, and fluoride. Okay. So heavy metals, these are ubiquitous in our environment. And I will tell you from having measured a variety of different markers in blood, in urine, in hair, men do have detectable levels of aluminum, cadmium, mercury. I actually got the abbreviation for mercury wrong. It should be Hg, not Mg, arsenic, and lead. Now, it's highly variable, and I never know what I'm going to find in somebody. But, sure enough, the sicker the man and the older the man, the more accumulation of heavy metals he's had. And particularly if you've had a habit like energy drinks, soft drinks, canned beer, you're going to have high levels of aluminum. If you've been a smoker, you may have more cadmium. If you've been a seafood enthusiast and you happen to love your tuna, your swordfish, your shark, your halibut, or your insert large carnivorous fish here, you're going to have higher levels of mercury and so on and so forth. Petroleum toxins, very ubiquitous in our environment. One of the ones that you really need to know about is glyphosate. Glyphosate is a terrible toxin that is, of course, legal and is being sprayed in huge quantities on so much of our food, particularly wheat, which is one reason why when it comes to organic, I'm very serious about if you're going to consume grains, they really have to be organic, because I absolutely think that our modern problems with glyphosate and other pesticides are very, very significant, and organic food in general, I opt for that reason. Plasticizers, really relevant. So we know that these are estrogen mimicking compounds that disrupt our hormonal axes. And this gets back to the whole idea of an endocrine disrupting compound, which, if you haven't heard of it, 10, 15 years ago was a niche topic. Now it's a very mainstream topic in the scientific literature. And these compounds disrupt our body's ability, or our body's hormone systems, and most of them mimic estrogen, which means that arguably they oppose testosterone. And by disrupting these systems, we know that they're having a negative effect on male reproductive function. We believe this is behind the rise, at least in part, of male birth defects. More and more male children are being born with genitalia that are not fully developed. They have to have surgical correction for the penis being malformed, or for their testicles not actually having descended out of the abdomen. So this is not just about protecting you. This is about protecting your unborn sons. And of course, by the way, I should mention that in a lot of what we teach men when we coach them and train them is how do you protect not only yourself, but all those rules may apply to your wives, your girlfriends, your mothers, your families, which means you're in a position to protect your nearest and dearest, including the women who may be bearing your male children. So plasticizers, very bad. It's very important to minimize your exposure to plastic in our modern world. Next up is fluoride. Fluoride's come under a lot more attack recently because some very damning scientific studies have been done on the effects of fluoride on the brain. And, fluoride, I think, just really wrecks metabolism, which is why I avoid it and counsel my patients to avoid it. I did an interview with Dr. David Brownstein. I consider him the world's expert right now on iodine. And I'm not sure if anyone even comes close to him. The closest would be Guy Abraham, who he studied with for years and who's recently passed on. But we talked about iodine and its relationship to fluoride and how you need proper iodine levels in order to have healthy glandular function. Glands are your endocrine system. They make the hormones, they make the hormone precursors and hormone triggers, right? So when we introduce fluoride and drive out iodine, we may be impairing our testosterone production. I haven't been able to find proof for that in the literature, but I certainly know that the men I put on high-dose iodine protocols, which is one of my favorite things to do, really see improvements in a lot of the metrics that we look for with low testosterone levels. They have more energy, they have better focus, they have a better mood, they have more energy and stamina and strength, and they have deeper sleep. So think about that. Last up is iron, which is not technically an endocrine disrupting compound, but it is well known that iron toxicity leads to low testosterone levels in the disease we know as hemochromatosis. So hemochromatosis is well known in the literature, and very tragically, the average age of death of these men is 57, and it tends to affect most significantly men, but it does affect women. But the average age of death, if I recall correctly, is about 57. Sadly, many of these people are not diagnosed into their 50s. I didn't include my own data in this presentation, but I'll just tell you quickly that I, didn't know about this problem. But then in my early 30s, about a year ago, I started to check my iron levels. And I was surprised to find that they were much higher than you would expect in a 34 at the time, 35-year-old now man. And what I found was that I'm actually heterozygous for this illness, and many more men are high in iron, which may be poisoning their pituitary gland and leading to subclinical or lower and lower testosterone levels over time. And I've started to screen more and more men for this in my practice because it's very easy to get a ferritin level. And if it's abnormally elevated, it's also very easy to screen for hemochromatosis, which may play a role in not only your health, but the health of your family and your future children. Jim, you want to add anything? I feel like I'm going on and on.
No, you're doing a great job. I'm really enjoying it. We got a lot of people tuning in right now. Thank you so much for watching. Yeah. Obviously, this is not what we'd call mainstream information. So if you could do us a favor, whether you're watching on Facebook or whether you're watching on YouTube, if you could just like this video, that would really help us out.
We would really appreciate that.
Yeah, we'd really appreciate that. Keep going, Doc. You're doing great.
And if you want to, send it to anyone who you think needs the information, because we know that, like Jim said, this information is being very suppressed. So we teach men how to protect their testosterone, and that comes down to a couple of key things, right? Eliminating their exposures, opening their detoxification pathways so that they're getting rid of these toxins appropriately, and then finding out what their iron status actually is. And in some cases, we'll do more advanced toxin testing if people want it, but iron's the easiest and, in my opinion, more important or most important. And that's why I love looking for hemochromatosis. It can be a really life-changing diagnosis to find for someone. Okay. Next up is nutritional deficiencies, which are really linked very strongly to toxic exposures. So you'll find that the more, Karen, I'm delighted to hear that you're on day 6 of the iodine loading phase. That's awesome. Yeah, we see a lot of people seeing a lot of benefit with that. So you'll find that toxins increase your need for nutrients. And so that's one of the things we see going hand in hand is low nutrient levels on the one hand and high toxin levels on the other. This is a terrible chicken or the egg, vicious cycle that people get caught in. And so really optimizing your nutrition is key. But what's funny about this is a lot of people will focus on the micronutrients and they'll say, buy my testosterone boosting supplement this or supplement that. Okay. But what's more important is actually their macros and their total caloric intake. So people will have a low testosterone level just if they eat a low caloric load, low protein and low fat levels. This goes back to the stress connection, right? Which means that if you're under stress, not only is managing it and mitigating that increasingly important for you, but you also need to be very mindful of your dietary choices and how that stress is pushing you to maybe eat foods that you shouldn't be eating. getting adequate amounts of protein and fat are vital to optimal testosterone levels. And we'll talk more about that later. There's so much to unpack there because we see men who think they eat a high protein diet really not eating a high protein diet, which sometimes surprises them. And then minerals, magnesium and zinc, are critical for optimal testosterone function, but also for optimal sex hormone binding globulin levels. And so you'll see a lot of derangements in men who've got low mag and low zinc levels with regards to their testosterone levels. And then vitamins. Vitamin D is essential for testosterone production, and B vitamins are essential for testosterone production, but also for the effects of testosterone. One of the things that you'll see is that when men have low levels of nutrients, not only do they not detox well, but they also, even if they have high levels of testosterone, may not do well with higher and higher, with those high levels. They may have symptoms of low T that are not related to low T, but that are related to these nutritional deficiencies. And a lot of people are not properly screening for these problems when they test men for low T. It's just a simple, your T is low, here's your T, see you in 3 to 4 months for your lab test. We're going to talk about why that's a flawed approach soon. Minerals, I will mention, are really, really important. And I mentioned insulin earlier and its connection to aromatase, and how the more fat you have due to higher insulin levels, the more you're going to turn testosterone into estrogen. Again, we don't want to block that process because the body's naturally trying to protect you with estrogen. Story for another day. But what you'll see is that men who've got extra body fat have almost always got some kind of mineral deficiency, and this creates problems with their testosterone vis-a-vis aromatase. So repleting mineral levels in men is critical for optimizing their hormones. Okay, vitamins, vital to life. That's why they got their name. They're critical to metabolism. They're critical to detox. They're destroyed by food processing, and they're consumed by stress. And that's why men are so low in these in our modern world. So weightlifting and testosterone, and this is our last topic before we dive in and really pull this all together. Jim, I think between the two of us, you're in a better position to comment on this than I am, because you've trained so many people over the years, in general, and right. You've also counseled them a lot and worked with a lot of people who either had low testosterone or who were on testosterone replacement,
or even myself, right? That's one of the biggest things we look at, like, men from the 40s and 50s, their testosterone was dramatically higher, even in their 50s and 60s, as opposed to young 20, 30-year-old kids today. And it comes down to manual labor. Like, if you don't use your body, you're not going to produce, like, your body's like, why should I, carry around this extra muscle if I'm not using it? Right. But the other extreme also, like, just about anything, this is going to be my Instagram post today, just about anything can be a poison. The key is the dose, right? So you've got people that aren't doing anything on one extreme, and then you've got people that are doing way too much on the other extreme that are knocking their testosterone down. So a lot of it is applying the right level of fitness to get what you want, right? So you want to apply enough stress to get the adaptation that you're needing, but not so much that you bury yourself, right? And then when you're brand new, you want to make sure that you add stress and stack it, on top of each other. And one of the biggest problems today is kids just don't play outside. They don't build that resiliency that most of us that in my age bracket, like close to 50, had hours to play outside and could build that foundation so they could adapt. And so, yeah, it's a weightlifting's great, but the trick is the dose, right? So it could be harmful and it could be positive, just like anything else.
And it's also, you mentioned the word balance earlier. If men and women don't balance their caloric intake to their weightlifting training regimen, it can be disastrous, which is why, you and I found a lot of synergy working together, because I may want to focus more on medications and supplements and medicine, or, certain aspects of lifestyle change like EMF mitigation or light therapy or whatever. But if you're there helping them understand what their training regimen actually ought to be, and then we're talking together about a case in terms of how much food they need and protein and what's going on, outside of the weight room, it gets people better results. And this Absolutely. Is also why you'll see in the literature on this is all over the place. You'll see studies where they found no improvement in testosterone, transient improvements in testosterone, changes in growth hormone, changes in this, changes in that. Much of the time, they're not controlling for caloric load of the subjects, and they're not controlling for stress levels. And one of the examples of this would be that, some of the favorite test subjects for the sports exercise community is college students, because they're broke and they want to make a little bit of extra money, and they're happy to get into the gym, right? Well, the study that you do on them during finals week is going to have radically different results than a study that you do on them in the first week of the semester when they're fresh off of summer vacation. So these are important little things that you have to know and understand. And I think that's honestly why Jim and I don't look so much at the literature for guidance on how we counsel people in, weightlifting, exercise, and testosterone. We're looking more at real world data. What do their hormones say? What do their HRV or their fitness tracker data or their sleep scores actually say? Because if you don't get all of it, right, and this is why I put weightlifting at the end, because if you're weightlifting without proper sleep, without proper diet, without, mitigating toxic exposures and properly nourishing your body, weightlifting may tank your testosterone because you simply cannot respond to the stress. And your body's response is to shut down in order to get you to slow down and rest, which is why the number one slide and the number one cause was stress and excessive exertion.
Yeah, absolutely. And people don't really understand that concept of it, right? And the other thing about the studies, if you take an untrained person and you have them do just about anything, they're going to improve. What I have to do for somebody who's untrained versus somebody who's been training for 30, 40 years is totally different. And the other thing that they don't consider in these tests is maybe your testosterone levels didn't change, but the way your body utilizes that testosterone changes. So the level doesn't change, but the fact that you can use more of it and it's more available, maybe it's not being shuttled into cortisol. Maybe there's more free T all of a sudden, but your total T didn't change. There's all sorts of factors here that you really can't, you'd spend the rest of your life studying every variable. So that's why it's so important to take a holistic approach. And that's why, like, when people reach to peptides or supplements or even TRT, if you're a dumpster fire and you're an absolute disaster, you're probably not going to get the results. Like, you can't put out a raging fire with a squirt gun, right? So if you're a raging fire, using a squirt gun is not a good tool. And that's what I would say a lot of these things are. If you have a candle on your desk, you can put it out with a squirt gun. But if your whole city is on fire, a squirt gun is not a good option. So a lot of people are using squirt guns to try and put out a fire in a city that's several blocks big.
That's right. And I think, to your point, it's really important to understand that there's so many other factors coming together to affect how the testosterone is used. And that's why we'll see men whose testosterone levels are not optimal, but they're functioning very well. And then the question is, are we going to replace your testosterone, or are we going to make changes to the things that we think may impact it? And what's our timeline for optimizing it? Because we don't want to leave men at these low levels or even mid-range levels for longer than we have to, because we believe, it's part of your quality of life. It's a very personal decision that you ought to make with a clinician who knows you and has time to counsel you on that. So, optimizing your testosterone. We know that it can be a little overwhelming. We know there's a lot of doctors, lots of gurus, lots of different people telling you things that are sometimes very impractical. I think Jim and I, want to set ourselves apart from that because we want to offer you something very different, which is really, we want to give you practical information, concrete advice. We want to be able to give you solutions that are tailored to your environment and your lifestyle. And we want to give you tactics as well as strategies that are not only effective, but that are efficient and affordable, because we're sensitive to how much, you all have on your plate right now. So many people come to me and they say, that sounds great, I understand, but, okay, and these are the top things that they tell me. So they've tried every diet and workout routine, they've tried every supplement, but nothing has worked. We see this a lot of the time, and oftentimes men, they've tried everything, but that's actually part of the problem. And the truth is that they have problems that are not actually being diagnosed. So they may have way too much stress. It's tanking their HRV and wrecking their sleep. And so it doesn't matter what diet or workout routine they use or what peptides they inject to improve their sleep or, what supplements they take. If they don't fix their stress levels, they're not going to get better. And that's just one example. I've seen very high levels of aluminum. I've seen very high levels of mercury. I've seen very low levels of different nutritive elements like selenium, chromium, magnesium, zinc. I mean, you name it. And, people just don't get these things, and they don't get them typically tested or monitored. And that's part of why they'll often fail on diets and workout routines. Jim, you want to add anything to that?
No, other than, most people are chasing just too many things, right?
Right.
It's just they chase so many different things, and they need to simplify and take care of a few simple things, and then go from there. And or they're basically looking at an influencer who might have trained for 20 years, is on performance enhancing drugs, and looking at his workout routine and looking what he's accomplished. And a lot of those pictures are photoshopped, and they have kind of unrealistic expectations.
Or not just Photoshop, but good old plastic surgery.
That too.
We talked about the Liver King's example when it came out that he was, lying to people.
Yeah.
And the example of what he did it's just people. It creates these totally unrealistic expectations for people.
Yeah. And if you live a primal lifestyle, you are not going to look like the Liver King, because it's not going to work. Like, that is anti-primal.
Yeah. A lot of men fall into the trap of saying, I just want a testosterone prescription. Here in Florida, I will see routinely billboards that say low testosterone evaluation, $45. I can tell you from behind the scenes that they are not checking what I would call enough labs to know where you really are. If they're getting you a prescription for that price, your encounter with a physician or a PA, nurse practitioner, is going to be very, very short. And what we see happening in clinical practice is men will come to us already on testosterone from another provider. They will not understand why, despite being on a high dose, they don't feel well, and they don't feel the way they used to feel. And what they need from us, and what we seek to deliver to them, is really an answer as to why, despite having supplemented with testosterone to the appropriate levels, or even super physiologic levels, they still don't feel well. Because the reality, like I said earlier, is the last thing men with low testosterone need is a testosterone prescription, which doesn't mean that they don't need testosterone prescriptions. It just means that they need a lot of other things often before that, so that we're not just allowing them to ignore the root of the problem and just get by on a testosterone prescription because it's convenient and easy. So the goal we have with working with people, particularly men with testosterone issues, is to teach you everything you need about how to optimize your health and your testosterone levels. Okay. And this leads us to another problem that we've really already talked about, which is that they just need to find the right supplement, medication, detox protocol, etc. I have to tell you that most men who are out there on what I call the do-it-yourself wellness kick, I totally respect wanting to fix yourself. I respect wanting to do your own research and wanting to get to the bottom of your own problems. We all have that drive, I think, particularly as men. But I have to say that getting guidance and mentorship and advice and insight is invaluable. And our whole goal with what we do on social media and what we do in our coaching programs and what I do in my clinical practice is to help people, figure out exactly what's going to help them. And the biggest mistake I sometimes see them making is thinking that they just need one more supplement or one more medication or one more detox protocol. And it's never just one thing. It's a combination of factors that's going to lead you to not only short-term, but long-term success and results. And sometimes the real solution that's sustainable doesn't feel good at first. Jim likes to tell people constantly that they've dug themselves into a hole, and they need to be patient with the process of getting out of it, because sometimes that just takes time. For example, if you've got a significant total body burden of toxic chemicals in your body, pulling those out may not be pleasant. We'll have people go through detox reactions as we help them get rid of toxic chemicals, toxic exposures, and it's not fun. But it doesn't mean that you got to be adding constantly to the mix of what you're doing. Frequently, that confuses people more than it helps them. Another common objection we hear from people is they don't have the time, they don't have the finances, or they don't have the energy to try. Completely understand and respect that. It seems like today, people have never been more strapped for time, financial resources, and energy. But the key thing that people have to understand is that there's one thing that you can't divorce in your life, and it's your physical body. You can sell every last thing that you own on earth. You can, cut off all the people in your life and find new friends and new family and so on and so forth. But you cannot kick the can of your physical wellness down the road. And this gets back to what I mentioned with hemochromatosis. We'll see these men dying in their late 50s, and any one of them could have been diagnosed in their early 30s or early 40s long before the problem snowballed into what it was. And we see this, quite tragically playing out in the epidemic of suicide in young men who are in their 30s, their 40s, their 50s. They really ought to be in their prime of life. And for many of them, if they would just have proper medical care and treatment and diagnosis, they might not be, making that unfortunate choice. So your mindset really matters about this. And I want to, put a fine point on that. It's very important to understand that the way that Jim and I approach this is for long-term, sustainable, significant, durable results. And we'll talk about that when we get to our case studies in a minute. And this gets back to one of the key things that I think is the flawed thinking that I want to really make sure we're really clear on. People are stuck in our modern world on thinking that they can't take the time to learn how to be healthy. They just need to go out, buy more supplements, take more meds, go for another treatment, another biohack, another whatever. They're not getting the right information and diagnostic information and recommendations. And often big problems that compound over time, as if with compound interest, are not being addressed. And that's leading to long-term failure, no matter how many supplements, meds, or treatments they go through. Okay, so let's jump into some case studies. So Ben came to us last fall. He's a software programmer. He's in his late 30s. He's married with children. He had an autoimmune condition called ankylosing spondylitis. He was struggling with energy, fatigue, and pain. ALT and AST, these are his labs. I'm going to run you through what I see in these labs. And for those of you who are wondering, these are labs that we are going to run as part of a medical program that I'll be explaining at the end. It's part of the key labs and panels that I like to run for men who are concerned about exactly the problems that are red flags for low T, low energy, low libido, low endurance and athletic performance, lack of mental acuity, work performance, etc. So his AST and ALT, those are liver function markers. Those were slightly elevated. Triglycerides were elevated. These are both signs that his liver is under stress, which is a lack of rest, lack of recovery, accumulation of toxins, and a lack of proper diet. His DHEA was half of the lower limit of normal and almost 1/10 of the upper limit of normal. I prefer to see people in the upper limits of normal. So he was very low in DHEA. This is one of your main stress steroid hormones. It helps control your immune system and control autoimmune conditions like such as the one he was struggling with. It also controls your energy, your salt balance, a lot of inflammatory processes in the body. DHEA is one of the things that declines with age and is associated with premature death and mortality. Cortisol was 0.5, which is less than 1/10 of the lower limit of normal. And this means that this person's exhausted, their HPA axis is completely derailed, they're not able to respond to stress well, their immune system is dysregulated because of the lack of cortisol, their sleep-wake cycles are disturbed. So this was a really significant lab finding. Vitamin D was 29. Even my most conservative colleagues who are not enthusiastic about vitamins think that 30 is adequate. He's below that. Those of us who've studied vitamin D in more detail tend to think that a level of 40 or 50 to 80 is more appropriate. That's a story for another day. But his vitamin D level was low. His high sensitivity CRP level was 8.16. This is one of the most important labs I think I check for men with concerns about their testosterone, because it's a marker for your long-term cardiovascular disease risk. Cardiovascular disease, heart attacks, strokes, etc., are the number one causes of death in men. And so when I see a high sensitivity CRP, I think this is a man who's at risk for being taken away from his family by premature death or disability. And we need to really stay on top of this and make sure that this level comes down. Uric acid was high. He also had a history, by the way, of gout. Uric acid can trigger gout, is associated with gout. And so you'll often see, people struggling with their metabolism of uric acid and having problems like gout when they've got all these other problems under the hood that doctors are not checking for. And we've got lots of things we can do to help men with gout recover from it by fixing uric acid levels. Testosterone was 465. That's, at least half, if not a third of what it should be. Some would say it's less than a third of what it should be. Free T was 10.2, which is not terrible, but it's not great. Zinc was 74. What does this panel really tell us, and what are the takeaways? Okay. Most docs who are looking for low T would check a testosterone and a free T. They might check a vitamin D. They might check a couple of these other markers, but most of them are not going to do this sophisticated of a workup. We didn't give Ben testosterone, and here's what happened. He cut out alcohol. He improved his sleep. We put him on a very targeted strategic supplement protocol. He got an exercise protocol from Jim. He underwent some lifestyle modifications, some walking, some light therapy. And this is what his wife wrote about his case on Instagram, which was very touching. We really appreciated. And, I'll just point out the part that really stuck out to me. She said, through the help of Stillman and Laird, my husband got his life back. And then she says, how? Through some amazing new medication? No, a strict elimination diet that cut out all toxins and poisons that are in many of our food, and by getting him outside and walking twice a day. I've never seen him feel or move better than he has since I've been with him, since he went through this program. This was a really profound case. This is a pretty typical case, I would say, that we see. Wouldn't you say, Jim?
Yes, very typical.
Yeah.
And I think when we make a statement like a very strict elimination diet, that sounds like hell on earth. But sometimes that's what it takes when you're in a really, really deep hole. You have to do some extreme things for short periods of time until you get yourself in a better place, right?
Right.
But yeah, this guy was he's doing so much better than he was.
And I want to reiterate, this was not a low T problem, right? We don't have a follow-up T on him. I would love to get one. But, it's kind of a good sign that we don't have it. It means that he's doing so well that he's not, running back to us for more medical care, which is, gratifying for us. But a lot of people would have looked at the low T and they would have said, you have fatigue, you have low endurance, you have low exercise capacity. You're struggling with all these symptoms of low T. Let's give you testosterone, and that will be the treatment. And I'm sure he'd feel better if he took injectable testosterone or Clomid or any number of other measures to boost his testosterone levels. But this is not the optimal approach. Okay.
Well, he would have continued on with the shenanigans that he was doing. That he needed. His lifestyle was what was putting him where he was. Right.
That's it.
And so the testosterone would have enabled him to continue to destroy himself.
And that is the thing about testosterone that men need to understand. Testosterone is a performance-enhancing drug. And we want you to have as much endogenous production of this performance-enhancing drug as possible. But the key is that using it in order to enable a lifestyle that's fundamentally toxic and unhealthy is, not a good strategy. So, Eric, we actually talked about this case in our weight loss program webinar last month, but it's a great example of a guy who worked with Jim. And, this was long before Jim and I started working together. And a lot of people would have looked at him and said, okay, well, you know what? We're going to put you on methylphenidate to suppress your appetite. And we're going to put you on testosterone. And we're going to give you supplements. And we're going to give you, fat burners. And, we're going to have you lift weights. And we're going to get you shredded. And Jim can tell you what happens to people who do that.
Some get results. Most don't.
This is Eric before and after working with Jim. Jim, you want to talk a little bit more about his case?
Yeah, that's I think about 3 months, and he came to me. I turned him down like 8 or 10 times, and he was on a reality show on MTV. He basically lost one of the reality shows because he was just so overweight that he's well over 300 pounds on the left. I mean, he's a big dude. He's got to be 6'3", 6'4". So we got him down to about 245, 250, which is a good weight for him. But I turned him down like so many times because he had some significant lifestyle issues that were causing his issues. And I was like, until you're ready to make some serious changes about who you are and slow down a little bit and actually figure out why you're destroying yourself for fun, essentially. He was literally punishing himself with his lifestyle choices. And then finally he said, man, I'm all in. I'll do whatever you tell me to do. And started with walking and then, playing around with finding foods that he would like. He was on the road a lot and nothing crazy exercise wise, just very consistent. And that's about a 3-month period there. You can tell he looks like he's on fire in that picture on the left.
Yeah.
He's a redhead. So I'm sure maybe he got a little too much sun, but who knows if they used makeup on him or what on the right there, but just, he looks inflamed on the left and much, much better on the right. And the cool thing is he's kept that weight off. That was probably around 2010. And you can go check his Instagram profile out, and he's, the lifestyle changes we enabled and the 80-20 rule stuff, he's kept it off.
And I'll tell you that, having tested a lot of labs and guys who were in Eric's position, before and after, a lot of men run to the labs. And we're going to talk more about this later because we have a coaching opportunity for people and we have also a labs and medical opportunity for people. But people are often looking for the answer in their labs and they want to get the labs up front. And there's a value in that, for a variety of reasons.
Some people just like seeing the data, right? It just
and I don't
makes
blame
it
them.
easier for them, and that's fine.
But I will say that, if you're significantly overweight, if you're eating processed food, if you're using your technology a lot at night, if you're exposed to wild amounts of EMF, if you're under a lot of stress, we know we're going to see problems with your labs. And frequently, we don't have to document the problems with the labs to give you the diet and lifestyle information that we've seen improve the labs and resolve the problems time after time after time, which is part of why we don't lean as much now, or I guess I'll say I don't lean as much now on lab testing in my practice as I once did. And I focus as much, if not more now, on the lifestyle and diet improvements that I know people need to make based on having worked with so many people, which saves people the cost of one-on-one consultations with me as well as labs. So this is from the Huffington Post article about this. He calls Jim his saving grace. And it's really funny. He omits the part where you turned him down 8 times, but
yeah, it might have been, who knows if it was 3, 4, or 8. It was a lot.
And this is another case, different Eric. Okay, for the record. So not the same Eric we just talked about, different Eric. This gentleman came to us under a lot of stress, busy fitness professional. Testosterone turned out to be 382, which is low normal. Free testosterone, though, was 5.4. I omitted the units here because, to be honest with you, they're boring. And I don't really, we could talk about that another time. But free testosterone was truly low, okay? And the thing that men need to understand about testosterone and free testosterone is many doctors are still stuck in the paradigm of testing total testosterone. And this is a very flawed metric of testosterone. So, this guy has low normal testosterone. Many docs wouldn't replace this. I think that's not a good idea personally. But you have to understand that your total testosterone can be normal and your free testosterone can be low. Your free testosterone is governed predominantly by your sex hormone binding globulin, which gloms onto and basically binds up testosterone. And it's a little bit like a brake pedal to the testosterone gas pedal, if you want to think about it that way. And so when you see a normal testosterone, if you're not looking at the free testosterone level, you will miss a certain number of men who've got a normal T and a low free T, and they're still struggling with symptoms of low free T. And many experts will actually replace based on the free T level and not the total testosterone at all. There was also, something interesting in his labs, which is that he had low normal white blood cells and low normal platelets, which is not normal for a man in his 40s, which is where he was. Okay. Red blood cells are normal. And technically all these are normal. So a lot of doctors would look at these and just say, oh, they just happen to be normal. But one of the things I've seen over the years in men who are on testosterone is many of them are very interested, and just men who are interested in fitness, is many of them are on a high zinc, low copper diet. And copper is very important for the production of white blood cells, red blood cells, and platelets from the bone marrow, as well as the production of energy in your cells. And this is not the first man eating a high zinc diet and taking zinc supplements in addition to that who I saw wind up with a low serum copper level. This serum copper level of 65 is one of the lowest I've seen in the practice in the years I've been running copper labs. And this is really important because this is an example of a case where a man with a micronutrient deficiency and a low dietary load of a critical mineral was not aware of it and could have wound up on testosterone replacement therapy. And he might have done very well for a period of months or years or whatever. But if you look at the consequences of a low overall dietary copper intake long term, we're talking sub 2 milligrams a day, which for me is a small dose, might be adequate for smaller people or people with more sensitive metabolisms. But for a guy who's lifting heavy weights, engaged in a lot of strenuous exertion, he needs a higher copper intake than that. And that could have compounded over time to chronic illnesses and disease. So we added beef liver as a supplement. We added nuts. We added seeds, which are typically rich in copper. 6 months later, copper's improved to 88, could still be higher. And more importantly, when we started testosterone, his ferritin came down from 250 to 150. I point this out because it's not the main thing that we did in the case, but copper helps regulate iron metabolism in the body. And so you'll see a lot of men with high ferritin levels and low or relatively low copper levels because of these phenomena. And this can create problems down the line, because when iron is not properly dealt with in the body, it will create a lot of oxidative stress. So Jonathan asked an interesting question. He says, how much beef liver do you recommend? And that actually depends on the case, Jonathan, because and this is why I like to get a complete dietary history on patients, because with beef liver, I've seen men overshoot as well. This serum copper level is 65. Most of my friends and colleagues in the integrated medicine world like to see copper levels, in the middle of the normal range, something like 90 to 110, 120. Over that, some people will cause problems, right? But you'll also see massive shifts in what people are eating. So, for example, if I tell you to take a 2 milligram copper supplement, and you eat no copper-rich foods aside from that, that may put you in the normal range. But if you eat a lot of nuts and seeds, you may be getting 2, 3, even 4 milligrams of copper per day just from the nuts and seeds. So if I tell you to take it, then a 2 milligram copper supplement on top of that, I may push you to 8 or even 10 milligrams of copper a day. And so I don't make those recommendations without looking at the patient's diet. And the thing I use to quantify that is an app called Chronometer. And I'll also look at this in light of things like their serum copper and zinc levels, because you will find many have got low zinc levels. And that was actually one of the problems that we saw in Ben's case earlier that I didn't make a very big deal about, but I want to go back to now. You'll see his zinc level was 74. We know that zinc is necessary for proper production and function of testosterone. And this is where, people will miss low zinc levels that are contributing to symptoms of low T, and not realize that just replacing the testosterone alone is not the answer to the problem. And zinc's necessary for a lot of other physiologic functions in your sex steroid hormone pathways. So by no means is its function limited to just T. Okay. So next case, last case, Sam, overweight, father 3, married. He was tired and overweight, but otherwise he was happy and healthy. I recommended that he get his testosterone checked because I've just started to do this in all men over the age, particularly of 30 in my practice. And, 30, 35, I might, pass on this in a healthy 30-year-old who's really got no problems. But, the minute most men develop an issue, I start to look at testosterone levels almost without fail, because so often they're implicated in the problems that they're having. And I'm not handing out testosterone left and right to men in their 20s and 30s, but I at least want them to understand where their numbers are. So he went to his regular doctor after talking to me. He got his testosterone checked through that doctor, along with some other markers. And it was really funny. The doctor said to him, I don't think we need to check your T. You don't have a lot of the symptoms of low testosterone. He said, no, I'd really like to check it. And the doctor said, well, I worry that it won't be covered by your insurance and you may have to pay for it out of pocket. And I don't know how expensive it would be. And, Sam said, look, I really want to check it. I understand I may have to pay for it. That's fine. Please just run it. And so finally he convinced his doctor to check it along with a ferritin level. Well, lo and behold, his ferritin level was 365. And I've mentioned ferritin a couple times before. And I write more about this in my book, Dying to Be Free, and in my blog posts over on my Substack about iron and iron metabolism. But the bottom line with ferritin, and the reason why I check it in men, is that iron overload can contribute to low testosterone levels, particularly in men who have full-blown hemochromatosis. But regardless of that, as ferritin levels rise, a man's risk of death goes up. And this, to be fair, is true of women as well, but men tend to accumulate iron and have ferritin problems more and more than women at earlier ages. So his ferritin levels elevated far beyond what I would want it to be in as far as an optimal range. His testosterone level is truly low at 200, and his free T is definitely low at 1.4. Not only was it low the first time, it was low on repeat testing. And the irony of this is his doctor had the gall to say to him, it's a good thing we tested your testosterone. To which Sam said, essentially, you mean it's a good thing that I convinced you to test my testosterone level after I had to ask you 3 or 4 times? And I include this story here because, many men who are struggling with their weight, struggling with their energy, don't think that the problem is their T. And many of them have normal testosterone levels, but some of them have low testosterone levels and have other metabolic abnormalities. And this is where we have kind of a chicken or the egg problem with iron. As iron levels rise, you're going to see testosterone levels drop. As iron levels rise, you're going to see metabolism go off the rails. You're going to see more insulin resistance. You're going to see more fat mass. These are going to create, and compound different problems. And so you're going to wind up, with more and more adipose tissue, more and more, that means fat, more and more fatigue, and so on and so forth. And so if you miss the testosterone problem here, these men may be hamstrung in getting the results that they want, losing the weight, improving their muscle mass, improving their sleep, improving their energy levels, and so on and so forth. So Sam's now on testosterone. He's feeling much better. There's no clear cause of his low testosterone that's been identified. We're going to continue working on that. But at the end of the day, we didn't want to leave him feeling the way he was feeling and having the body composition he had. And so he started testosterone. So let's talk about why what Jim and I are doing works. So it works because we use proven protocols with men we work with. You're going to hear a lot of different things out there in the influencer health and wellness info space. People are going to market their supplement to you, their testosterone boosting, pills and powders and so on and so forth, right? Jim and I have looked into a lot, if not the vast majority of these. We are going to talk to you about what actually works, not based on hype and not based on marketing, but based on actual experience working with real live people. We're going to give you self-assessments. So we're going to help you gather data on yourself and understand your data so that you can understand what's actually affecting your body, your physiology, and your testosterone levels. And we found that it's very helpful for men to have a setting where they have some kind of community of other men who are like-minded and who are trying to improve their testosterone levels. What we provide with our coaching programs in particular is accountability, clear instructions, genuine empathy. Jim and I understand what many of you are going through. We've seen so many men over the years struggling with low T, symptoms of low T, and we really want to help you get well, and we understand where you are and can help you find a way out. So Jim and I have made this as simple and easy as we can. But the secret weapon that I really want to tell you about is group coaching, which we'll talk more about later. But it's one of the things that we use to help people get the best results possible. Bottom line, we have an opportunity for you to work with us that we want to share with you today. Before I jump into that, Jim, do you want to add anything?
Nope. I think we get a roll into the offer.
Great. Okay, so this is our Testosterone Secrets program. It's 4 months. That's 16 weeks. There are 8 webinars. These are hour-long or so lectures that Jim and I are producing, and we're actually producing them as we speak. So you're going to get one every other week. The first one's already been recorded, and you get to listen to these, ask questions about them. Particularly if you're on the live webinar recording, we're going to be covering, as I said, 8 different topics that we think are essential and sharing with you the really key tactics and strategies for addressing those issues. Then we're going to have weekly group coaching calls. We've decided to schedule 1 call for every 15 men that enroll. The average call, based on our experience with other programs, is about 5 people. And at 5 people in an hour, each one of you gets more than 12 minutes exactly, right? So you get a lot of personalized attention. I have seen, I'm often overbooked with calls, but I've seen Jim stay on calls with people for an extra 20, 30 minutes, an hour. If they're really struggling, he'll get on the phone with people. We really have I would say we have, what's the word I'm looking for? Constantly over-deliver attitude about these programs. Jim, would you say that's safe to say?
Yes, I will, as long as I'm involved, that will continue to happen. Yeah,
and so we're very motivated, to see you succeed and to watch your progress happen. There's nothing I like more, I would say, than seeing the numbers get better. We've had a couple guys in the last few months in a similar program to this called Optimal Male Vitality. We've seen a couple of them post 100 sleep scores on their fitness trackers, which has been remarkable and really rewarding for us.
And just on some of these calls, these guys, when we first started, they sounded like they were in a war zone. And now they sound like they're in like a Zen state, so they're able to like turn off that go kill everything and drag it home, to which there's a time and place for that. But then they're able to switch over into that. I need to relax. I need to chill so I can go kill more things. Right.
Right.
Figuratively speaking, of course.
Figuratively, of course. I mean, unless that's your job, right? So comprehensive men's wellness panel, optional medical program. So that's a coaching program. And I want to explain the difference between medical and coaching because people get hung up on this. As many of you may realize, our dearly beloved government has got lots and lots of rules and regulations that doctors have to follow. One of those is that I cannot practice medicine in states where I'm not licensed. But a lot of what Jim and I do is education and coaching, where we teach people how to be healthy. That's not practicing medicine. So the offer I just told you about is a coaching offer. Okay. There's also a medical offer. That medical offer can only be offered in states where I'm currently licensed. Florida, New York, Virginia is where these are offered. You get a comprehensive men's wellness panel. This is a very extensive blood work panel. I'll go into more on the details of this later. You get an hour consult with me to review it and talk about your best way out of your abnormalities that we identify in your lab testing, as well as any complaints that you may have that don't show up on lab testing, things like joint pain or shortness of breath or fatigue or whatever. It's available, as I said, in Florida, New York, or Virginia. If you do not reside in Florida, New York, or Virginia, but you would still like to participate, you can fly to see us in Clearwater, Florida, which is where I live, and we can work out an in-person visit, which you can contact us for. If you come see us, you can then be a patient for an entire year. So if you want to have a remote Zoom teleconference after that to talk about follow-up questions or concerns, that's an option. Otherwise, you got to live in one of these 3 states. Okay. Let's talk about the normal pricing. So the normal pricing for the coaching program, the webinars are a value of $2,000. It's $400 per webinar. The group coaching is a value of $4,000. The total is $6,000. So $2,000 for the webinars, $4,000 for the group coaching, $6,000 total. Normal pricing. Sorry, I already went through that. Whoops. So normal pricing again, $6,000. Today, the special webinar pricing is $996. Okay, and that's going to be split up into 4 monthly payments of $249. So you're going to have a 4-month program, $249 monthly, 4 months. Very simple, very easy to jump into. All right. And that's a $5,004 savings when you compare the price of what we're offering it on this webinar compared to what the normal pricing is going to be. There is an optional medical program, as I mentioned. The value of the consult with me is $815. The comprehensive wellness panel is at least an $800 value. Arguably, this panel, if you go some places, could be $1,000 or even $1,500, but we're getting it for you for a better price, and I'm extending that, cost savings to you. You will also get 4 group coaching calls with me. These are for quick questions you may have about supplement protocols that I may share with you, or medication recommendations I may have, or anything that you're comfortable discussing in a group coaching session. And the total value for this program is $2,615. Okay. What does it include in terms of the actual, lab panel? So you'll get a comprehensive hormone panel, DHEA, cortisol, testosterone, free testosterone, sex hormone binding globulin, estrogen, all your steroid hormones. You will also get key mineral markers for metabolism. That's copper, zinc, and magnesium. You're also going to get your electrolytes, your kidney function, liver function, etc. Then we're going to look at anti-aging and vitality biomarkers. This is your IGF-1, your uric acid, a variety of other markers I won't get into here. These are the ones that I think are most important for your fitness and longevity. Often, and if you have it, we'll go into fitness tracker data. What's your Oura Ring data like? What is your Apple Watch data like? What's your Fitbit or your whatever wearable fitness tracker you may have? We'll get into what the data says and what it means for your wellness and particularly for your testosterone optimization. And then we'll come up with a comprehensive plan for how you can address the problems that we find in your fitness tracker data and your labs, including, as I mentioned, a comprehensive supplement protocol. So the optimal optional medical program this week, it's $997. There's only 20 spots available, so only 20 men are going to be working with me in this program due to the constraints on my time. And you can make that with a $599 deposit and $398 due after 1 month. If you would like, we can get an optional add-on of a NutrEval plasma, which will give us information about B vitamins, methylation, toxins, a lot of other information that can be very helpful and important for your longevity. That add-on is $500, and you have to get it done prior to going over the labs. Okay. Questions that we get very often. So what about insurance? We cannot offer any kind of coverage for the coaching program for your insurance. We can't offer it if you for the medical program, if you live in or travel to Florida, Virginia, or New York, we can work with giving you a super bill so you can then submit that to your insurance. But I have to tell you, they make it very hard to get anything covered. Okay. We need your help filling out the paperwork. Sometimes this comes back and forth to us. It's a lot of work. The reason we can't just bill your insurance is that if you're not aware, the insurance is terrible. They really try to prevent doctors from just taking care of patients, at least taking care of patients the way the patients want to be taken care of, which is why you all overpay for your insurance and you hate it and you don't feel like you get anything for it. And there's a reason why we don't take it. I really couldn't afford to offer these plans for the price I'm offering them for if we were going to work with insurance for a long list of reasons I won't get into. Okay, HSAs. We do accept payment for HSAs for the medical program. You can split that payment into multiple cards and accounts. You have to pay the initial deposit up front, and then the rest can be in the payment plan, as I mentioned. And I want to go back into the secret weapon of this, which is group coaching. I love this quote. Karen says, "Insurance is not terrible; it's horrible." I totally agree, Karen. It's awful, which is why we don't deal with it. At least we deal with it as little as possible. Jonathan, I do not have a recommendation for insurance policies. I recommend that people look into healthcare sharing ministries. And for a couple people are asking if these are only for men. The medical program's only for men. And yes, you can sign your husband up for it through the link that Jim has included. You'll just have to, enter his details and payment information and so on and so forth. So I want to talk about group coaching because this is something that a lot of people are new to, but that we have transitioned into focusing on predominantly because it allows us to help more people and to get better results. So Jim, do you want to tell the story basically of how we got into group coaching going from one-on-one?
Well, when we first started interacting, we talked a lot about some of the things that you find frustrating with your practice as far as people actually following through. You would call somebody and the amount of money that you would have to charge for you to be in like weekly contact with people is what people need to be contacted.
Which was something like $2,500 to $2,500 for like a month was typical. Mm-hmm. And $12,000 was typical for 6 months. Right. $14,000 if we included the labs. Right. So I really priced out the vast majority of the people who wanted to work with me, which was sad because I really wanted to help regular folks and I knew that I could do it. I just couldn't do it working with them one-on-one exclusively. Right.
And we got talking about, my career and how I'd consistently got such great results with people. And I would tell you it's basically beating people over the head with the fundamentals constantly. And you kind of were like, really? Like, that's it? I was like, yeah, like literally I'm telling people the same thing over and over again, year after year after year after year. Even if they've been training me for 20 years, they'd come and complain and they go, well, I'm not doing so well right now. Are you getting outside? Are you eating enough protein? No, I've kind of slacked on that. I'm started drinking. I'm staying up late at night watching TV. Well, you got to get back to the basics, right? So I started following up with some of your clients. That way you didn't have to do it. That way it allowed you to not be burned out. And then we started having some accountability where people would get coaching on a regular basis. And then we transformed that. Like we started the Optimal Male Vitality. We started doing the group work. And we saw how well effective that was in getting people consistent interaction. And then we decided when we did these courses, we were like, well, how can we help more people in an affordable way?
Right.
And we were like, well, they need contact because there's so much information out there. Mm-hmm. It's all out there. Like you can go out on YouTube yourself and find,
you can drown in information.
You're going to drown in information.
We can literally listen to multiple things at the same time all day and wind up not knowing what to do.
But it's all out there, right? And the big thing is people are either applying too many things or they're not doing any of the right things. And so we need to, every person's a little bit different in the advice. So they bring it to us and we basically give our opinion. We give them an action plan. And then, we get on every call and we're like, so how's everybody's habits going? Because, people will be like, well, I haven't struggled and I haven't lost any weight. I don't feel any better. Well, are you doing this, this, and this? Well, no. Well, you probably need to take some action.
And so if you're doing all the things, right, you get into, well, what are you doing or not doing that's actually making things worse? So a common thing that we see in people, particularly once we get them to have or use a fitness tracker, right, is they'll be doing all the things, but they're doing too many things and it's creating too much stress. So it tanks their HRV and it wrecks their sleep scores. And then by helping them understand what things are tanking their sleep scores, we can help them fix their sleep scores, fix their HRV, and see things like hormone panels and profiles improve. And then they feel better, more importantly.
Yes, absolutely. And it's really the accountability. I mean, a lot of people just don't take action. Um, that's basically it. And so the more interactions people get with us, and as we interact with them, we get to know them. There might be a mental aspect of this that a lot of people. That's something that a lot of people don't talk about. There's emotional, spiritual side of this that a lot of people don't get into. That it's the reason you can't, stop, eating too much. It's the reason that you're depressed all the time, or you're overworking, or you're training too hard. You're using.
We see a lot of people medicating with exercise and
As a
medicating with
drug.
food and medicating with, bad habits of various types.
Absolutely. So the more interaction we get, the better, the easier it's going to be for us to figure out an action plan for you. And everybody's their own little science experiment.
That's right. Another common objection we hear from people is, what are you going to teach us that we haven't already heard, that we can't hear on a podcast with our friends like Ben Greenfield or Jay Campbell or Joe Rogan or, Andrew Huberman, right? We find two things. Number one, there is a big difference between strategy and tactics. Sun Tzu said that, strategy without tactics is the slowest road to victory, and tactics without strategy is the noise before defeat. And what he really meant was, if you don't have strategy and tactics, you're not going to do well. And what you hear about a lot in podcasts and a lot in, social media and on popular wellness blogs and articles, and I read these with great interest because I'm interested in, are they getting results? What are they telling people? Is it useful? Do I see this panning out in my practice in real life? A lot of what you're hearing is strategy, and you're not actually getting tactics. And tactics take time. They take training. They take accountability, and they take troubleshooting very frequently. We're not going to give you the same advice if you live in, Winnipeg, Canada, as if you live in Brownsville, Texas. We're not going to give the same advice to a 35-year-old father of three that we're going to give to a 75-year-old retired empty nester. We're going to give you different advice. We're going to help you understand your unique context. And that is something that people so frequently are not understanding from the podcast and blogosphere, right? They'll hear something like, I have all my patients or clients do 90 minutes of HIIT every week. And we know plenty of our people are so busy and so stressed that if they add, Danielle asks if is there a medical program for this like women? Danielle, we can talk about that because we definitely can set that up. And I'll have Michelle, my nurse, reach out to you to talk to you about that. So we'll often see people who are, they're doing things that don't make sense for them specifically because they can't maybe handle 90 minutes of HIIT. Maybe their magic number is going to be 20. And maybe they can handle 90 minutes of HIIT if they increase their protein and caloric load to the point that is going to allow them to compensate for that. Jim, you want to add anything to that? I know you've got a lot.
Well, do they even need 90 minutes of HIIT? Like, what are those goals? It's like,
I know.
And that's the thing too. Like, a lot of the times, and we've seen this in our executive wellness programs, our high achieving programs.
Yes.
A lot of it is they're just doing too many things, and we have to simplify. They're doing so many things that their body just overwhelmed, right? So a lot of it is simplification.
Absolutely. Yeah. I want to be really clear with people what Jim and I are here to do. The true value of this program and what we seek to do with people we work with is to help them take control of their health, help them learn how to manage their health and the health of their family, break free from a reliance on pharmaceuticals, supplements, biohacks, the whole nine. We want to give you a natural life that's sustainable, normal, affordable, and so on and so forth. And we want to help you save money in the long term. We've worked with a lot of men who came with us for counseling on testosterone in particular, but many other aspects of their health. And many of them, we help them solve their problem, and they're out there living their lives, and they'll come back to us if and when they need additional help. But we're not running a conventional testosterone replacement clinic where, to be blunt, the economic model is to get everyone on a, monthly plan. We have that available for men who we feel truly need testosterone replacement therapy, and for men who agree that that is the best, course of action for them, for their health and their well-being and their quality of life. but this is fundamentally a teaching, coaching program. The medical program is really designed to help men get an idea of where they are. Do you need T? Is your T problem related to something else? Like we saw with Ben, that lack of cortisol, that lack of DHEA reflected very, very poor sleep, very, very poor recovery, and giving him testosterone really wouldn't have been a comprehensive solution to his problem. We're going to teach you all kinds of stuff like that over the course of this program. Do you want to add anything to that?
I think we've summed it up wonderfully.
Great. I want to remember, low testosterone levels long-term lead to metabolic dysfunction. They lead to diabetes, heart disease, cancer, dementia, depression. These associations, I believe, are very well-founded in the literature and can be backed up in an abundance. And that's why I think optimizing testosterone levels in our modern world has frankly never been more important.
I think one thing, that's perfect. We're basically going to be talking about purpose. In these group calls, we're going to get into problem solving, like what's going on in your life? How can we enhance your life? What are your goals? What are your aspirations? It goes way beyond testosterone, especially in these group calls. Like the optimum vitality calls that we've done are incredible. And we talk about everything you could possibly imagine. And that's a big part of the problem today for men is they don't really have anywhere to go.
That's right.
The worst thing a man can do is go in a relationship is go to his wife and there's nothing wrong with that from time to time. But if you're constantly complaining to your wife about, your struggles, that is not going to do well for your relationship. So if you have a group of men that you can go to and say, hey, here's what I'm struggling with, let's figure out a way we can solve this problem, right? That works a lot better in the long run, not only for yourself, but also for your relationship.
And I often see men and women giving Jim pushback on that advice, but I want people to know that Jim says that as a man who's trained predominantly women for 25 years and heard them complain about this exact thing on a daily basis in his gym to him. So, and I've seen this happen as well in my practice.
And I've seen it happen in my own relationships. When I brought my problems into the relationship, they listened for a little while, but eventually they're just like, you fix your problems. I don't want to hear about them. I want to tell you about my problems, but don't tell me about yours. Right.
Yeah. Right. So this is a time-sensitive offer. We are running this for a limited time. These prices are available until Wednesday, so you have some time to think about it, talk it over with your spouse, talk it over with anyone who may be helping you finance this. After that, we probably won't run this program again for another 6 months to a year. We're not really sure. Depends on the level of interest that people have. We would love to have you. We want to give you time to think about it. Again, this is a time-sensitive offer, so we encourage you to act soon. Let's talk about why we're doing that. Because I think that's really important. We want to work with people who are the most motivated and committed and ready to take action. That's why we have a time-sensitive offer. We've found that, if we work with and put more time into a small group of people, in this case, men, we're going to get better results for them if they're really motivated, committed, and ready to go than if we are rather working with all comers who are not necessarily ready to commit and jump into the program. So that's why we're making it a time-sensitive offer. And I also want to reiterate this if I haven't made it abundantly clear. One of the biggest mistakes that I see men making is that they delay their wellness. And I think this is a great strategy for the creation and perpetuation of illness. So many, many times we will see someone come to us who's known for a long time that they had problems, but they've delayed getting care because one or another factors was holding them back. Cost, time, stress, and sometimes it's access to care. I mean, the reality is a lot of men would be happy to sign up for a program like this, but a lot of them don't know about it. And, that's partly because not a lot of people are offering things like this. And we've seen so many good results with this that we're really happy to be providing it for men. We hope that if you're in this category, that you will go ahead and jump in and take the time now, because the last thing we want to do is have you calling us after you've had your first heart attack or, been diagnosed with your first cancer and be asking us for what you should do when you're really late in the game and behind the ball. All right. Coaching program is limited to 100 people. We want to limit it because as we said, we're going to have one call for every 15 people. So that puts us on the hook for a whole lot of coaching calls. And we really want to be able to give you guys plenty of time. As I said before, average group coaching call numbers for us are 5 people. That means you each get 12 minutes every single time, and you're going to learn a ton from the other people on the call. You're going to learn a ton from listening to Jim and I take their questions and process their problems with them and help them understand what's going on. So we are only going to be taking on 100 people in the coaching program.
And then all these calls will be in the course with timestamp summaries. So you can go through and look at the summary and go, oh, I want to learn about that. Go to number whatever. So that's really helpful. So
yeah. Yes, and you can get access to all the recordings afterwards, as Jim said, and Jim's also going to be posting workouts and exercise routines. Jim, do you want to expand on that?
Yeah, I'm going to basically do whatever you want me to do within reason. I'm just typing Michelle's email address into the. I'm not very good at.
Jim, I'm gonna just drop a. Okay, yeah, that's Michelle's email address.
Right. So we'll look at, you can ask me specific questions about here's the problem with exercise. The advice I'm going to give somebody who's been a powerlifter for 40 years is going to be totally different than somebody who basically can't get up and down off a chair, right?
And that, by the way, is part of why we are not doing what most of our colleagues are doing with regards to online courses. We'll sell online courses, but when I started to say, Jim, you got to do an online fitness course, the look he would give me was, how am I supposed to make a course for everyone? He's very, very meticulous in recommending very specific things for different people. And if he's able to get on a group call with you and talk to you about your biomechanics and how you feel and how you function and what your body shape and posture or strategy are, he's going to be able to give you, really impactful advice. I've seen him clear up people's back pain, hip pain, knee pain in a matter of minutes. That they've sometimes struggled to control or address with just, orthopedic surgeons, PTs, chiropractors, exercises, foam rollers, like you name it.
Well, a lot of times the advice I give people is very simple, right?
Sure.
One or two simple little things. And so it's really hard to give like a broad answer of like, how much of this should I do? How much of that should I do? I don't know. What's your data look like? How long have you been training for? What are your goals? Is your goal to look good and feel good? Is your goal to be a performance beast? Like, there's so many different variables that I need to get context onto where you are and what you're trying to improve. Like I've worked with Dr. Stillman's mother. I gave her one exercise that literally changed her back. One thing that she was to do daily, right? She did some other things as well, but that one thing got her going in the right direction. I might have to give somebody else a whole bunch of things to do in order to get the result that they want. So a lot of it depends on who we're working with, the context. And a lot of it is like looking at what they're doing and taking things away, because a lot of times I think people are doing so many things that it's not giving them the result they want.
Absolutely. Yeah. We've only got 20 spaces available in the medical program, so I encourage you to book now. We do anticipate that this will fill up. If you want some basic numbers on this, right, we've got about 10,000 people who are going to get an email about this offer and a copy of the replay of this webinar. 100 for reference is, it's 1% of 10,000. 20 is 0.2% of 10,000. So a very significant proportion of, we don't need a lot of people from the people who we're going to be sending this out to sign up for us to be totally booked. So I don't want you to miss out, and I recommend that you book today. Again, this is only available until Wednesday night or until we run out of space. Availability is based on a first come, first served basis. We've been at it for an hour and 40 minutes now, which is longer than I thought it was going to be. We want to thank you for joining us today. We hope we delivered some value and helped you understand testosterone at least a little bit better. And now we're happy to take questions if people have them.
I think we had a lot of questions during the call.
I didn't think we had that many.
We did. Oh, and Robert, I messed Michelle's email. I just put stillman.com and stillmanmd.com.
Honestly, in order to not clog up her inbox, you can actually use the contact form at stillmanmd.com. But she may get mad at Jim later for having just plastered her email all over the internet.
That's okay.
Jim will have to ask forgiveness.
I will ask forgiveness. How do you lower your SPG if you have high normal total T but a low free T?
Yeah, so I think Nick asked this. Right. Well, I didn't see that one. Where's that?
That just came up.
Okay. Is that from Nick Tan? No.
One's from Mike.
Okay.
And
Yeah,
there's
yeah.
somebody else asked about sex binding globulin as well.
Mike, good to see you here. So listen, that's an interesting question. How do you lower sex hormone binding globulin if you have high normal total T but low free T? So for review, I mentioned this briefly in the webinar, but I want to reiterate it if people are not familiar with this. So your sex hormone binding globulin will put the brakes on your testosterone production, or rather production testosterone function. So if you have a high total testosterone, but a high sex hormone binding globulin, you'll have a low free testosterone, which means you functionally will have low testosterone activity or function or performance, right? So some of these men will have symptoms of low T and will require or benefit from, I'll say, testosterone replacement therapy. Sex hormone binding globulin is a really fascinating molecule because as much as I listen and read the experts on sex hormone binding globulin, there isn't a magical, solution to a high SHBG, short of some of the anabolic steroids that bodybuilders will use to, as Jim likes to say, clean it out. And so you can do that to lower a sex hormone binding globulin, but from my experience in conversations with other practitioners, the more common approach, at least on the cutting edge, is for physicians to just give more hormone to overcome the high sex hormone binding globulin. Now, I say that there are some reasons for a high sex hormone binding globulin. They are things like high glucocorticoids, high stress, low magnesium level. There are a bunch of other ones that I have a list on somewhere that I look up when this comes up that I haven't memorized. But that's the number one thing. Jim, what are your thoughts on this?
This has changed. There's a lot of things that's changed in the TRT. I'm not a medical doctor, just so you know, but
Jim's not a medical doctor. He's just a power lifter.
I started doing, I'll be completely honest, and I'm very honest about people with my performance enhancing drug use in the past. And so I started using very large amounts of testosterone, not very large, but for the average person, 1,000 milligrams a week is quite a bit. For powerlifters,
that's 3 times what we might use.
Right. But for
5 times the highest starting dose we would use. So, yeah,
right. But for a power lifter or a world's strongest man competitor or a bodybuilder, that's like your maintenance dose, right? So there's a lot of people running around taking a lot more than that. So I didn't take that much compared to my colleagues. But even 3 or 4 years ago, there was this big, like, sex binding globulin was this evil creature and estrogen was too. Everybody had to be on an estrogen blocker, right?
Right.
Well, now we've learned that both of those things might not be as bad, especially estrogen. Like, the number of people that actually need to be on an estrogen blocker is like 0. Like, your estrogen should go up as your testosterone goes up, right? And estrogen is very protective to your system. And the same thing with sex binding globulin. There's a lot of people that are really smart people that are like, yeah, we really shouldn't be so concerned about it. So it's one of those things where you have to look at symptoms and you have to look at how you're doing. There's, they say, I've heard people say green tea kind of helps clean it out a little bit. There are certain anabolics, like you said, that will clean it out. A lot of times, lifestyle is contributing to stuff like that. So, but I don't know, like that. There's a number of different really smart people that say it doesn't matter, and there's a lot of smart people that say it does matter. But I look more at Dr. Stillman, anyways. When he looks at labs, he looks at more at symptoms and how the person is feeling as opposed to numbers. So, are you having terrible symptoms? Do you feel like crap? And don't get so caught up on one particular number. I mean, unless it's like a triglyceride or A1C or a number that says your body's on fire and it's going to explode. Those are something you're going to want to pay real close attention to. But a lot of these recommendations have changed radically in the last couple of years. Right.
It's true. Mike, let us know if you have any other questions. We're happy to clarify any of that if you'd like.
Did you see there's a question about having a husband come down from Florida?
To Florida?
Or from Canada to Florida.
Oh,
Would you be able to work with them?
Yes, Tracy, we could do that. And we're happy to have you come visit Florida. It's lovely.
You might not leave.
Facts. Yeah. Why leave? Okay. 10 below 99. Any thoughts on using red light therapy for prostate and testicle health? Lots of thoughts on this. So what I want people to know about this is, and I didn't talk about this in the webinar,
This is not medical advice. This is information only, by the way.
Right. So one of the big things that Jim and I talk about, and I alluded to briefly in the webinar, is EMF. So EMF, electromagnetic radiations, frequencies, etc. These are having a deleterious or negative effect on cellular health and bioenergetics by disrupting the water battery of life. That's Gerald Pollack and Robert O. Becker and quantum biology. You should go see my quantum biology webinar that I just recorded with the Quantum Biology Collective for more information on that. My blog's got a link to that if you want to go to stillmanmd.substack.com. But basically, when we look at the effects of EMF on any organ, but specifically the prostate and the testicles, as you asked about them, we may surmise that radio frequencies and microwaves are going to degrade bioenergetics and energy production and worsen cellular health in these organs, right? So why do I start with that when I talk about red and infrared light? We may be able to use red and infrared light in order to restore the cellular battery and mitigate the effects of radio and microwave radiation to these organs. I also want to mention that, one of the biggest sleep disturbances we see is what we call nocturia, which means getting up in the middle of the night to go to the bathroom. Many men who struggle with this have got an enlarged prostate, and that is the reason for their nocturia. And why do men get enlarged prostates? Well, the number one risk factor, as far as I know, for prostate cancer is actually artificial light at night or shift work, because it wrecks your melatonin levels and ruins your melatonin signaling. And melatonin is what keeps your cells nice and healthy and relatively small. Why am I mentioning that? Red and infrared light can improve melatonin levels in the body and therefore sleep. So if you tell me that you have benign prostatic hypertrophy or any prostate problem, I'm going to say more sunlight, better sleep at night, less artificial light, and potentially some red and infrared light therapy to the testicles or the area of the perineum that is near the prostate. I'm interested in using therapeutic lights, and I have one or two that I recommend to people sometimes that are focused. And you can, if you use them on your perineum, you can actually use the light or direct the light right up into the prostate. I haven't had a clinical case where that was really profoundly impactful, but it's one of the things that I will recommend to people because it may be of benefit. Okay. Moss asks, are there any long-term / irreversible effects on fertility with prolonged low T? So frankly, I would say the answer is no. I would say that the answer is no. But I would also say that it's not something that what I'll say is this. If you don't have enough LH and FSH, you're not going to have normal healthy sperm, and you're not going to have high enough levels of T. There are so many different elements to this that affect your fertility. Like, for example, if you have erectile dysfunction, right, you can't have an erection, can't have sex, well, then you maybe have trouble conceiving, right? But the predominant problem is the lack of viable sperm, which is really more a process from the central nervous system of lack of sperm motility, lack of proper sperm morphology, so that the sperm can get to the egg and fertilize it. And even men who have very low testosterone levels will be able to bear children. There's many men in their 60s, 70s, 80s with very low T who are still having kids. And there's men who've used very high doses of testosterone that have shut down their normal endogenous production and thereby impacted their sperm that could impact their fertility. So I don't view prolonged low testosterone levels as something we have to be terribly worried about with fertility, because there's so many tools in our toolbox to fix it and restore normal fertility. But I wouldn't want to leave a man there anyway for other reasons.
His own mental health. And here's the funny thing about this. A lot of this is really individual because, they'll say testosterone is bad for your fertility. I had buddies of mine that were on boatloads of testosterone and got their wife pregnant. There numbers of them. Yeah. So, and there are many, many people that are very, very, very unhealthy and manage to get their manage to conceive, which I, really, it's kind of interesting how that happens. But do you want to go to the no fap question? Do you want me to take that on?
Go ahead, Jim.
All right. Here's the deal. So men have this energy, right, that they need to get rid of, right? And a lot of guys will use masturbation to medicate themselves. And that can, if it's excessive, it will take away from your drive. It uses up resources, right? A lot of that depends on, are you using pornography to do it? Are you using your imagination? Because if you're using pornography, that's going to spike dopamine even higher. A lot of people that have had a lot of abuse have chronic masturbation issues. So they're using it to basically manage abuse and manage shit they've had happen in the past. So the answer is like, what is the dose? If you're chronically doing it 4 or 5 times a day, which there are people that do that, and that's all you're doing in your life, that's a problem, right? If it's something that you do from time to time, so you don't go out and get yourself mixed up with somebody you shouldn't be mixed up with, just the fact so you can get, that energy out, then I would say it's not necessarily a bad thing, right? So it's all context, right? And it all comes down to, is it like there are people that have literally lost their jobs because they become addicted to pornography and masturbation, right? So in those cases, that's terrible. Now, I would say most guys would be better off taking that energy instead of watching pornography and masturbating and go out and, chase excellence, right? But it's very hard to say, like, is that, going to knock it? It will, like, if you're chronically addicted to it and it's affecting you up at 3:00 in the morning, masturbating instead of you being sleeping, that's going to affect those things. But I would say, yes, it has an effect, but also what is the dose and what is the, how often and all that good stuff.
I haven't seen anyone do, I don't know, I can't remember if I've ever looked, but I haven't seen anyone document that it changes testosterone levels. I wouldn't be surprised if it did. I've never really thought about this or used this clinically, so I don't have any personal, or I guess I'll say professional experience with it. But I think that we treat men who, and we don't really even talk to them that much about this. If we think it's a problem or maybe a problem, we may get into it. But, I don't see it having a huge impact.
I think it's a problem today because so many people are, instead of trying to go out,
right? But I think the vast majority of men coming to us this is not part of it's not a significant part of their problem.
No, but I think in the younger generation, it's becoming a significant problem because they're basically chasing this easy pleasure instead of going out and meeting a girl and meeting her and doing the work you have to do to convince her that you're valuable enough to have, shenanigans with. They just take, I've got unlimited options on pornography, and I think it messes with your dopamine more than anything, which leads to depression, which leads to like lack of motivation, whether that leads to low testosterone or not. I think the dopamine, the easy dopamine part of it has a worse effect, a bigger effect than the low testosterone if it does do that.
Yeah. And that's
you don't want dopamine to ever be easy. That's why cocaine is so bad, because you get this massive influx of dopamine for no work. You want high dopamine to come with high effort.
Yeah. And I will say I've heard some men anecdotally say that it had a huge impact on their performance and their drive, but I've never seen one of them measure their testosterone levels along with that.
Right.
So on that note, if there's no other questions, Mike asked another question. Would enclomiphene be something to look at for low free T versus taking testosterone? Yeah, definitely. I would say so, Mike.
It's a tool. It's a tool in the toolbox.
It's a tool in a toolbox. Yeah. So, all right, everyone. Thank you for attending. Thank you for watching. We look forward to seeing you in the coaching program. Jim, any closing thoughts?
Thanks for tuning in. This was a good one. Lots of great information. Please like it. Share it with anyone you think you'd find valuable.
We appreciate that.
We look forward to the opportunity to helping you out.
Absolutely. Take care, everyone. Have a great day.